Hello friends, I am your health coach, Dr. Harkirat Wilkhu. Today we will talk about cardiovascular diseases that rank top 3 among the 80% of chronic diseases worldwide and are known to be the leading cause of death globally. When we talk about heart care, we need to focus on all aspects which helps to improve heart health. The cardiac care management has multiple approach, broadly divided into conservative and lifestyle aspects. Although conservative management requires various medical and interventional methods to care heart diseases, lifestyle management plays an important role to manage, support and reverse the comorbidities and improves quality of life. Cardiovascular diseases cause morbid events, known as cardiovascular accidents, like myocardial infarction, ischemia, heart failure, stroke, etc. The CVA is manifested by various hidden and prominent factors. The important factors are high blood pressure, dyslipidemia, and diabetes. The risk factors that contribute to these cardiac manifestations may be grouped into 3 categories. Non-modifiable risk factor, which we can't change, like family history, age, gender, and race. Medical risk factor, the comorbid chronic conditions, which can be treated, managed by medication, like chronic kidney disease, diabetes, hyperlipidemia, thyroid problems. The list is quite long. Modifiable risk factor, that we can modify for better health. These are mostly lifestyle related, such as an unhealthy diet, a sedentary lifestyle, stress and tobacco use. The effects of a faulty lifestyle may show up as high blood pressure, increased blood glucose, raised lipids, obesity, etc. Cardiac syndrome is a complex group of signs and symptoms, which may be classical or rare. The common signs and symptoms, like pain in chest, shortness of breath, which most of you know, but rare signs and symptoms are neglected most of the time. You should be aware of these, like recurrent back pain of unknown origin, giddiness worse on walking or rising, recurrent unusual heartburn, unusual cold sweats, frequent yawning, nausea, shortness of breath on exertion, chest pain getting worse on exertion. Therapeutic dietary management is the most important tool for cardiac care, which considers the DASH diet and hypoglycemic diet. Simple rules are: eat 1 serving of vegetables at every meal. Eat 1 to 2 whole fruits, rich in potassium, daily. Increase intake of nuts and seeds to get more of magnesium and omega-3. Drink 8 to 12 glasses of plain water, preferably slightly cold and in sips. Reduce daily consumption of saturated fat and oil, like butter, clarified butter, ghee, margarine, palm oil. Better prefer oils that is rich in polyunsaturated fatty acids, like canola oil, corn oil, soybean oil, generic vegetable oil, sesame oil, peanut oil. Reduce daily consumption of common salt, that high in sodium, limited below 1 gm, 1 teaspoon per day. Or, prefer salt low in sodium. Avoid carbonated, fizzy drinks, as it causes calcium loss. Avoid caffeine intake, like black coffee, purple green tea, herbal tea. Some food items are known as superfood, like in vegetables, leafy greens, beans and legumes, broccoli, table radish, garlic, tomato, spinach, beetroot and beet greens, kale, celery. Fruits, like oranges, grapefruits, lime, watermelon, spotted banana, blueberries. Miscellaneous dairy product, like yogurt, nuts and seeds. If you're fond of fish, then salmon, sardine, is the best choice. For vegetarians, protein from vegetable source is good, like soya. Exercise is second important tool for cardiac care. Various components of exercise activity like warm-up, stamina, strength and flexibility. For cardiac health, cardiopulmonary exercises, known as stamina exercise, which includes heart, vessels, and lungs, are good. Best stamina exercises are brisk walking, slow jogging, jog and walk, swimming, cycling, elliptical cycling. While doing cardio stamina exercises, we need to maintain the heart rate. The optimum heart rate during the exercise is between 150 to 130 beats per minute. Individuals with hypertension or on medication, the exercise heart rate should be between 130 to 110 beats per minute. Breathing exercise is important to absorb more oxygen. Various breathing techniques are yogic breathing, like Anulom Vilom, alternate nostril breathing, Bhastrika, forced belly breathing, and, in Western technique, diaphragmatic breathing, and pursed lips breathing. Quantum effect of exercise. When we do exercise, there is a sequence of physiological benefits. On doing the exercise, the muscles are relaxed, reducing the arterial tension. Also releases endorphins, the good hormone, which helps to repair, rejuvenate, and reduces physical stress. It also induces sound sleep, leading to mental relaxation. Once physical and mental relaxation is induced, it increases stamina, causing improved heart rate. When exercise is continued for a long time, it helps to improve kidney filtration, and also helps to reduce or maintain the weight. Body's response to physical activity. Meditation, yoga, exercise, and sleep reduces the respiration rate, heart rate, blood pressure, muscle tension, and also harmonize the brain waves. Stress is known to be maintaining and triggering factor for many acute and chronic morbidities. Stress can be managed by various methods, like exercise, which is an active form of stress management and it releases good hormone. The endorphins. Yoga, a passive form of stress management, which induces deep mental and physical relaxation. Breathing techniques. Broadly, breathing techniques are in active and passive format. Breathing techniques relax the physical and mental sphere. Sleep hygiene is also a good method of reducing the mental stress. Sleep hygiene, an important method to improve stress levels. Although the exercise helps to improve a sound sleep, but still need to improve the sleep hygiene. For improving the sleep hygiene, follow the following steps. Maintain the sleep timings. Avoid afternoon naps for more than 1 hour. Avoid caffeine and nicotine, especially after 7 p.m. Avoid heavy meals after 6 p.m. Keep your bedroom dim lit. Do some breathing exercise for 5 minutes. If you still have sleep issue, then do some forward, backward counting with each breath for 5 minutes. Health behaviors play an important role in cardiac care. Tobacco, especially smoking tobacco, is considered as second most vulnerable risk factor for all chronic diseases. Whether tobacco is used as oral or as smoking, it's very harmful. Tobacco has over 4,000 listed chemicals. For cardiac care, we need to understand the effects of the following: carbon monoxide, which destroys oxygen; acids, which destroys lung tissue and increases imbalance in gaseous exchange; alcohol cauterizes the brain and disturbs the physiological control of brain-to-body system. The overall impact of tobacco can be understood as following. It increases blood pressure. It reduces good cholesterol, the HDL. It increases bad cholesterol, the LDL. Damages the arteries and blood cells. Overall, smoking increases the risk of heart attacks. In health behavior, we also need to know the health impacts of alcohol on our body. As though alcohol is known to have some good effects on the physiology, but when consumed more than limit, on daily basis, it causes quantum effects on the body. Alcohol increases the blood pressure, increases the bad cholesterol, the LDL, increases triglyceride, reduces the good cholesterol, the HDL. In nutshell, alcohol increases the risk of plaque formation and heart diseases. Let's recap. Have regular checkup if you have family history or preconditions. Monitor your blood pressure on daily, weekly, or fortnightly basis, or as required. Take your prescribed medicine regularly. Avoid extra pinch of salt and caffeine. Avoid tobacco. Avoid frequent consumption of commercial food. Drink 8 to 12 glasses of plain water. Do regular exercises, especially cardio and breathing. Manage your stress. Thank you for watching. If you have any queries, please feel free to communicate. We will be happy to support you.